And it is that time of year once again. Medicare's annual enrollment period about to begin October 15th. And with a record 4.18 million Americans set to turn 65 in 2025, the need to get this right is overwhelming. Joining us now trying to navigate these critical decisions is Betsy Chin. Hi, Betsy. She is the Senior VP of Medicare Advantage at UnitedHealthcare. Thanks for joining us here for this important discussion, Betsy.
For having me.
Betsy, for those who are new to Medicare or what this really means for the annual enrollment, why is it such an important time of year?
The Medicare Annual Enrollment period, which, as you mentioned, begins October 15th and runs through December 7th, is an important time of year because for anybody who's already on Medicare coverage, which is millions of Americans, it's the one time each year when they can compare the plan options available to them for the following year. Now, for folks who are just turning 65 and just getting into Medicare coverage, they get a special election period that occurs the 7 months around the time that they turn 65. But for anybody who currently has Medicare coverage, it's important to compare your plan options during the annual enrollment period, which begins October 15th.
All right, so I have a friend asking for a friend who's about to turn 65, and you spoke of that period before and after, or do they face penalties? Can you explain why this timing is so critical for those who are about to be 65, and what are the consequences for missing these deadlines?
Absolutely, yes. For those turning 65 and just getting eligible for Medicare, you get a special enrollment period that starts 3 months before you turn 65. It includes the month that your birthday's in, and then 3 months after. And that 7-month window is your initial enrollment period, and it's great to sign up during that time just for what you mentioned, which is making sure you don't face any penalties later. While you're in that period of time, you should really compare your options, everything from original Medicare to Medicare Advantage plans and Medicare supplement plans. So again, use that 7 months around your birthday when you're turning 65 to compare what type of Medicare coverage is right for your health needs and your budget.
So if you are still working, a lot of 65-year-olds are with their employer plan. Do they need to sign up for Medicare still?
You should look into it, absolutely. Some people are able to continue on their employer-sponsored plans past their 65th birthday, but it's good to look into your Medicare options as well to make sure that you don't face penalties down the road and to make sure that you know if there's a richer plan available to you that you would also be eligible for.
All right, a lot of people hear HMO, PPO when they're comparing plans. Talk about the difference between the two and how should people decide for themselves which is the better coverage?
HMO plans tend to revolve around a relationship between the patient and their primary care provider. Think of these as plans that highly value the care coordination that comes from a close relationship with your PCP. And often in exchange for that coordinated care, you'll see lower costs, things like lower premiums, deductibles, lower copays, coinsurance, generally richer benefits on HMO plans. By contrast, PPO plans tend to offer greater flexibility with the doctors that you see and may not require or will not require referrals to see specialists directly without the coordination of a PCP. And again, in exchange for that, you may find different costs on those plans. So it's really good to consider both the coverage that you need, the relationship that you have with your doctor, and what you can afford as you consider HMO versus PPO options for your Medicare coverage.
All right, I know you only have a half minute here. What are the best ways to make sure that your doctors and prescriptions are covered under a new plan?
I would recommend taking a look at the plan's network, which is the list of hospitals and doctors that are included, and the formulary, the list of covered drugs. These can both change on an annual basis or even more frequent than that. So it's important to take a look at the network and the formulary and make sure that what you need is covered.
Any last minute message to our viewers out there who are about to start their enrollment period?
Take your time as you look at your options and don't be afraid to seek help. I'd recommend starting with MedicareEducation.com.
All right. Betsy Chin, Senior VP of Medicare Advantage at UnitedHealthcare. Thanks for joining us this morning. Very important discussion for Live Impact News here and our viewers. Appreciate your time.
Thank you.